Good evening, friends, and welcome to Insight. I am your host, Pat Gagliardo, and tonight we'll be discussing health and alternative methods of treatment through naturopathic means. And as always, a little later on in the program, I will be taking your calls and I will be answering your mail. But right now, I'm going to introduce this evening's guest. Good evening, Dr. Deirdre O'Connor. Welcome to the show.
Thank you, Pat.
It's a pleasure to have you on. Now, Deirdre, I'm somewhat familiar with naturopathic physicians, but for the viewers' sake, can I ask you, please, what actually is naturopathic medicine and a naturopathic physician?
Well, in a nutshell, we're general family practitioners trained in the treatment of disease and restoring health through natural means. And that's what it is.
Okay. Where are some of the schools located?
Schools are located, there are only 2 schools. Actually, there's 3 schools now. There's one opening in September. The 2 schools are in the Northwest, the Bastyr College of Natural Health Sciences in Seattle, Washington, and the National College of Naturopathic Medicine in Portland, Oregon. And now I believe it's going to be called the Southwest School of Naturopathic Medicine in Scottsdale, Arizona.
What is some of the training like? What do you go through?
It's 4 years postgraduate, which means it's a doctorate degree, 4 years postgrad. And the training is very similar to allopathic or traditional medical doctors, and yet very different. The first 2 years are similar in that we're trained in the basic medical sciences of anatomy, physiology, biochemistry. The second 2 years are also similar in that we're also looking at the clinical sciences, cardiology, gynecology, gastroenterology, pediatrics. But at the same time, we are studying botanical medicine or herbal medicine, homeopathy, a lot of time in nutrition and clinical nutrition, physical medicine, and some of our colleagues will also study advanced study in natural childbirth or acupuncture or oriental medicine. So while we're studying those clinical sciences, we're studying the other therapeutics that we'll be using to treat problems.
And what about diagnosis, prognosis, and the like?
Well, diagnosis is very similar. If someone comes in with a sore throat, I look in the, we do a standard physical exam, looking in the throat and checking the person physically, running throat cultures or lab studies that are needed. And we function as general family practitioners, so you still have to arrive at a diagnosis, and your workup is very similar, using diagnostic imaging, laboratory tests, whatever, physical exam, history. And the treatment is what's very different, because we're going to be focusing in 2 ways. One, we want to look at what a person's problem is, but from 2 different directions. We want to, first of all, be able to restore their health, and second of all, find out what is the cause of their problem. Why does this, it's not enough to know that a person has a gastritis or an otitis or an ear infection, but what might be causing it other than just an infection or something like that? Why are they susceptible?
So what would a typical office visit consist of?
Well, the first visit is generally an hour long, and we spend...
An hour long?
An hour long is the first visit.
Okay.
So we'll be spending time doing, generally it's a long history, because many people that we see have chronic complaints. They've been through a traditional route and they're looking for other answers. One, that either traditional medication has not worked for them, or they're experiencing side effects, or they're just not getting better. So we spend a tremendous amount of time going through their history and also investigating lifestyle factors. What are their exercise patterns? What are their habitual intake of caffeine, cigarettes, alcohol? What is their attitude? What is their diet? And what type of psychosocial stressors they have working on them as well.
So it appears then by what you're saying that a person that goes in, you really, just by you saying it takes an hour, I mean, that to me, who is used to going in to see a doctor and you're in 5 minutes, maybe 10 minutes after an hour or two's wait, and he's reading your chart while he's going down the hall to the next patient. I was just, that kind of just overwhelmed me a little bit. What about nutrition then? Because it seems to me, by what you're saying, that you take an entire view. So do you work a lot with nutrition? And
a ton. In my practice, I do, and I would say that's a very large part of our practice in Mystic, because we're looking at why is a person susceptible. So a person, we will look at a person that may have a nutritional problem. Perhaps they have high cholesterol. Well, that's obviously most often a dietary issue. And working with them and also helping them along with various vitamins, minerals, or herbs that will help deal with the high cholesterol. For instance, it's one thing to teach somebody how to adhere to a lower cholesterol, lower fat, lower sugar diet. But then there are many herbs that can be very helpful in helping the liver process the different cholesterol or different fats. And they've been demonstrated time and time again in multiple studies to decrease serum triglycerides, serum cholesterol, and can be very useful in the management of these type of conditions where people might automatically go into medication, which is not as efficacious.
Well, since you deal with natural medicines and botanical medicines, and how will the practice be affected? How will your patients be affected if this bill, this FDA's enforcement bill, H.R. 3642, that's in Congress right now, and if this passes, how is that going to affect your practice as well as the care or the drugs that you prescribe, these natural or botanical medicines for your patients?
Well,
what will happen then?
A couple of things are going to happen. One, patients will not have access to some of the things that we might prescribe. They may not have access to some of the things that they could use quite safely and self-prescribe. So, I mean, it hits them from two sides.
Is there something they can do?
There certainly is. They can write their congressperson, their representatives, and tell them that they want natural health care supported.
Freedom of choice.
Freedom of choice is a big thing. And in fact, the American Association of Naturopathic Physicians is working very hard on this issue with the natural health care industry and working very hard with the Clinton administration in healthcare reform.
I'd like to ask you on a percentage basis, if I may, Dr. O'Connor, about in your own, I'm only speaking directly to you now, and I'm not taking all naturopathic physicians into this question. How would you determine success rate? If someone had, if someone had a real serious situation that would, can you perform surgery? I mean, what is a limitation of a naturopathic physician if in fact there was something wrong with a person who had not only a nutritional problem, but perhaps something that required a surgical procedure? What happens then? Well,
certainly when someone comes in my office, you know, I do a complete evaluation of them. And if I feel that their situation will be better handled by an allopathic physician, whether they need medication, whether they need surgery or some other procedure that I cannot perform, or I refer out and use all the ancillary services that we have available in many specialists in this area. And this comes to light many times. For instance, I see a tremendous amount of people with rheumatoid arthritis. This is a chronic degenerative condition, and many people have side effects from the medication that they're on. Most of the time, what we're able to do for these people, because I see them with end-stage very amount of joint erosion and joint destruction, we're able to decrease the amount of medication that they need, although they still need to use prednisone or mild amounts of methotrexate or whatever's being used, but their need for those medications is significantly reduced. They have better motion, they have less pain, their lives are enhanced. But they still do need the medication, so I have a good relationship with people in terms of
so you can do
back and
referrals.
forth.
That's good.
Right.
Okay. Because you deal with botanical and natural herbs, extracts, etc., does it take longer for them to work in the system? I mean, is there a need to take them longer than, say, someone who comes in with a strep throat and needs 10 days worth of antibiotic? Does the botanical or does the natural herbs and such take longer? Well,
it's according to the condition. There are some herbs that are very rapid acting, and of course we can think about this as some of the over-the-counter laxatives with Cascara sagrada or senna. You got it the next day, no problem. Or digitalis, which is from botanical sources. Many of our drugs are from herb sources. So there are some herbs that are very rapid acting. In my practice, we don't tend to employ those as much. We're using herbs that have a more gentle restorative action on the body system. So yes, you will be using those longer. In infectious disease, for instance, a sore throat or whatever, we might be only using a 10-day course as well of an herb that has antibiotic-like activity.
Hold on to that thought. Viewers, please feel free to call us, in-state and out-of-state, to talk with Dr. O'Connor. She is here, so you can make some phone calls. Call us here now, 1-800-300-TV26. Now, you mentioned homeopathy before. What exactly does that term mean?
Well, homeopathy is a very old form of medicine developed in the 1800s by a German physician, Samuel Hahnemann, and it's using minute doses of various substances to stimulate the the innate healing response of an individual. And it can have profound effect on a person's mental, emotional state, as well as their physical condition.
Okay, thank you. Again, callers, in-state and out-of-state, feel free to call us here tonight so you can speak with Dr. O'Connor. Don't wait until the program is over and then call. Call us here now, 1-800-300-TV26. And wait for us to come right back. We have to take a word from our sponsors right now, but when we return, we're going to go straight to the lines. That number again, 1-800-300-TV26. Now stay with us, and we'll be right back. Thank you. Hi, and welcome back. And for those of you who may have just tuned in, you are watching Insight Live with me, your host, Pat Gagliardo. And we are going straight to the lines to speak with our guest, Dr. O'Connor, on naturopathic medicine. Go ahead, Jim from New London, you're on.
Yes, Dr. O'Connor. When dealing with, for example, the terminally ill, i.e. Serious illness like various forms of cancer, is there a point reached where a compromise would have to be made where you would suggest or encourage more conventional medicine to be applied, where you would probably see that maybe the naturopathic isn't doing as well, or you could, or is there a complete switch, or is there a compromise where you work together with the conventional, with serious illnesses?
Well, the answer to that is yes, and in fact, I don't feel that naturopathic medicine itself offers a panacea for any terminal type disease, particularly cancer. There's a tremendous amount that we don't know about that yet. More and more research is coming out about the prevention of cancer through nutritional means and the support of a patient in terminal phases of cancer with nutrition so that they do not die from cachexia or cancer starvation. So it's very important to have an integrated approach for the health and well-being of each person experiencing that.
Thank you very much, Jim. Have a pleasant evening.
You too.
Go ahead, Charlotte from Oakdale. You're on the line.
Thank you. Doctor, I was wondering what your type of medicine can do for a person who has drug sensitivities. I'm allergic to wasps and Demerol and all the keens, and if I need minor surgery, I really don't know what to do.
Boy, I don't really have a good answer for that question in terms of, it's mostly that you're allergic to the different...
Anesthesias and anesthetic, yeah.
I think that the best answer to that would be to refer to an allergist and get yourself tested in a small doses of of the other samples available to you.
Yeah, I've done that.
Yeah.
I didn't pass.
Oh boy. Well, the other thing is to see a naturopathic physician to prevent anything from happening, so you don't have to use those other surgeries.
Okay.
Thank you very much, Charlotte. Have a pleasant evening.
Bye-bye.
Go ahead, Tony from Groton. You're on.
I'd like Dr. O'Connor's opinion on the use of the herb pau d'arco in cancer patients.
I don't have a lot of information on the use of pau d'arco specifically on cancer patients, so I'm just going to have to table that one.
Okay.
Sorry we couldn't help you with that one. Thank you, Tony. Charlotte. Go ahead, Tony from Groton. You're on. Go ahead, Leo from Waterford.
What would be treatments for chronic fatigue syndrome?
Well, chronic fatigue syndrome is a broad spectrum of many different symptoms that a person will have. And so most people coming in are going to report different types of symptoms, and you're going to be treating the individual specifically. But to start off with, you have to make sure that that person's nutrition and their diet is excellent, that they have a good exercise pattern, that any obstacle to cure is in the way, that they're not using any alcohol, caffeine, cigarettes. And then you can try a different vitamin mineral regime, trying to build up their immune system with known immunoenhancing agents. There can be some botanical medicine used, echinacea, ligusticum. There's different mushrooms that are also helpful, ganoderma and astragalus. So there's many different routes to be able to help people with chronic fatigue syndrome, and it is a chronic situation. Most people do better, but will have their ups and downs throughout time. Still learning a lot about that.
Thank you.
Thank you very much, Leo. Have a pleasant evening. Dr. O'Connor, I can't thank you enough for being a guest on my program. Please say hello to your colleague and wonderful friend, Catherine Flanagan, for me.
She's doing a great job. Thank you.
Yes, she is. And it was a pleasure to have you on. I
Thanks
look
a
forward
lot.
to seeing you again. When we come back, I'm going to be going right to the lines. So those of you who are waiting for me, please be patient. I will be taking your phone calls very soon. Grab a cup of coffee, and I'll be back right after this. Thank you. And we're back. Go ahead, caller from Canterbury. You're on the line.
Hello, Pat. Yes, my question is, will I ever marry again? And if so, when?
Well, first of all, let me say this. I don't believe that that decision is totally out of your own control, meaning you got to just sit around and wait for somebody to come along and pop the question. What I'm feeling from you is a little anxiousness. I felt a little apprehension and maybe a little bit of trust in your own sense of self at this point in time in your life. If you're I know that there's loneliness about you, but I don't know if you're really ready to make that kind of commitment. So let's not use the words, will I ever get married again? Do I perceive that to be in your immediate future? Probably not. Friendship, relationship, companionship, yes. But you've got to get over that hurdle a little bit of that lack of trust, that lack of being secure in yourself. So call me back either toward the latter part of the year or into the early new year, okay?
Uh-huh.
All right, caller.
No.
Thank you very much.
All right, bye-bye.
Good night. Go ahead, caller from West Hartford. You're on.
Yes, I've been in a relationship about 8 months now, and do you see it going anywhere?
Well, first impression comes to me that even though it's relatively new, I don't feel that 8 months is long enough to even be really, considering my own opinion, really to consider a long-term or committed relationship at this point in time. I feel like you're still kind of getting to even know one another. And even though 8 months, I'm not feeling it's been real powerfully strong, say in the last 2 to 3. I'm not feeling the nurturing. I'm not feeling the growing and the want of more and more togetherness. If anything, in the past couple of months, I'm feeling a little more of pulling away, sort of. So I can't say to you at this point in time that my impressions tell me that it's going to be a relationship to become a full commitment. I'd have to say probably not. If anything, ultimately you'll probably go your own way. Okay. You had another question?
Yes.
Go ahead.
Do you see another relationship coming?
I thought that was going to be your second question to me. I will answer that also in the affirmative, yes. But in the immediate time frame of, say, this year, probably not. Let's look into late summer, late winter even of '94 for positive change. And even at that, I'm not going to say that I feel that it's going to lead to anything in a committed sense like a marriage. But a better relationship, more communication, absolutely.
Okay, thank you.
You're very welcome. Thank you. Go ahead, caller from Woodstock. You're on.
Yes, hi, Pat.
Good evening.
I've had some tremendous changes over the last year in my life, all positive ones.
Mm-hmm.
And I recently met someone that I feel very comfortable with, and I just wanted to see if you could see anything in that.
Well, yes, and I'm going to tell you why I can say that to you very immediately. Communication, it's like you met recently, but you've known each other forever. I just feel very, very comfortable with the relationship. There's an openness, there's some childlike times between you. You can laugh together, you can share innermost secrets, if I may, and for a relationship to be so new, that's really marvelous. So knowing that and knowing the comfort that I feel, I think this relationship is probably going to grow very quickly and grow into something very solid, probably before the end of the year, and that's not that far away. But you're not really ready for total commitment at this point. You want to let him know that without hurting feelings. But I believe he's receptive enough to hear everything you have to say. Right from your heart.
There is some distance involved. Do you think that will create a problem?
That's only for now. That's not long term.
Okay. Thank you, Pat.
You're very welcome. Thank you. Go ahead, caller from New London. You're on.
Hi, Pat. There's a man that I'm very attracted to, and I've told him how I feel, and he feels the same to me.
Yes, but there's limits. There's confinement here. There's inability to make that move. My mind shows me confinement or an inability at this time. Be patient. I'm sorry. I don't mean to be rude, and I don't mean to interrupt, but I have to interject because my impressions, as you well know, have to take priority. So sometimes I have to cut you off in midstream. I don't mean to be rude, but that's the way I have to go with the energy that's presented to me. So let me say this. Patience in this particular relationship is the key here. A lot of understanding, but time. My mind says it's going to take time for it to get to a point where you'll probably be able to be really together and make some distant goals or future goals, not distant but future ones. So be patient.
So you do feel that
I feel
may
very
develop.
positive, but these other circumstances have to be worked through.
Yes.
Patience, because it's going to be time involved. Okay?
Okay. Thank you.
You're very welcome. Thank you. Go ahead, caller from Bristol. You're on.
Hi. I have a question. They're kind of intertwined. Do I have anything nice to look forward to for the future, especially financially and in a relationship?
Nice. That's rather different. We don't get that description very often, and I kind of like that. I'm going to say rather, yes, but I'm also getting with you distant, meaning monies will improve, but not as quickly as you want them to, and I'm getting in spurts, like perhaps a little better monies now, and a few months later a little bit more, and a little bit more, and that may very well have to do with a relationship, but you're going to have to be patient. I am not feeling I'm feeling nice, and I'm feeling better within, say, 2.5 years, within that time frame. Okay? Thank you. I think you understand what I'm saying, don't you, caller?
Does this have to do with the relationship? Is that what you mean?
The relationship and the monies, my mind are showing me intermittent, and that's why I'm getting within that time frame. So be patient as well. Okay?
All right.
Okay.
Thank you.
You're welcome. Thank you. Go ahead, caller from Norwich.
Yes, Pat. First of all, I've been watching you since you started. Your program is terrific.
Thank you.
I was a very St. Thomas. I didn't believe. But I had two friends that called, and you did the good and the bad, and that gave me more positive attitude to talk to you.
Okay.
I have had medical problems. I'm having a lot of tests. Do you see any surgery to help with the pain I'm having in the future?
Actually, what came to my mind is 2 procedures. Now, one procedure, testing, I'm getting like process of elimination sort of thing, which they've already done.
Yes.
Up until the last, I think, 3 weeks to a month. Now I'm getting more conversation probably between physicians and surgeons that for an 80% improvement would probably require a procedure, a surgical procedure. But I'm okay about it because I'm feeling it's quick and probably done through modern technology, maybe laser or whatever, and recovery time not being extended. So, and you're a fighter. You have a lot of inner strength. So you'll help that recovery process. You'll be all right, caller.
Also, I've been lonely in the last 4 years since I lost my husband. Is there, will I ever get over this loneliness?
Well, as you know, time is usually the healer of most situations in our life. It's difficult when you have something that is probably the best. What I mean by that is it takes longer for us to adjust to the loss when things can be so wonderful. That's what I'm talking about to you. But you have wonderful people around you. One gal stands out in my mind, and I don't believe she's a relative. I think she's a friend. She thinks that she has a weight problem, and she focuses around the midsection.
Right,
and her hair
right.
You know who I'm speaking
Yes.
of. She's a lovely, lovely person. And she's been a very positive influence in your life. Listen to her more often. You get mad sometimes because she wants to get you going, and you're hurting still, but she loves you dearly. And I believe as long as you've got that sounding board and that outlet, you'll be all right, caller. You're the one that's kind of putting on restraints. You really aren't looking for companionship right now. As I said, when we have the best, and the best is removed, that's tough. That's a tough act to follow. But you'll be all right, caller.
Well,
God bless you.
You're right on the button there, Pat.
Thank you.
I'm telling you,
Thank you. God
I couldn't
bless.
imagine.
Don't get me to crying because my makeup will be all over my face. Thank you.
Thanks very much, Pat.
God bless
Bye-bye.
you. You're welcome. Good night. Go ahead, caller from Norwich.
Hi, Pat. I have a piece of property for sale, and I've had it for quite a while. Do you foresee me selling it in the very near future?
Okay. Now, let me tell you, first impression came to me with that property. Why do I find that something adjacent, something that is bound, something nearby is causing a problem? Something, maybe it's adjacent property or something about, something on the boundary, my mind says, is a problem here. I don't know if I'm looking at the way the land from way back when was separated or pieced, but something tells me there's something around it or near it, adjacent, boundary, that is a problem. You're going to have to try and work through that, and you have to dicker money again. Yes, the property will go. Unfortunately, do I find it's going to go in the immediate future? Probably not. So you're going to have to work through that other problem area.
Do you foresee any change in my financial status in the near future?
My mind says you're bobbing, meaning you keep your head above water and then it gets tight and your head above water. Eventually, yes, and probably when that property goes, it's going to be a big sigh of relief for you, but not right away. And you're going to have to dicker with the money again, unfortunately. But if that's what has to happen to let go of it, if I were in your shoes, I really would consider it because it's a noose around your neck. Thank you.
Thank you.
Good night. And now we must take a word and listen to our sponsors. And when we return, I will be answering your mail. Those of you who are on the lines, please be patient and stay with us. I'll be with you shortly. Welcome back. And the first letter comes to me from Richard S. from Wyndham. Richard, you asked me about career, something with music, and marriage. In looking at your photo, I know that you are a very nice, warm, and kind young man. I did not feel, however, that you would be in the music field, but I feel that the work with you needs to be in your hands, working with your hands and some mobility. Unfortunately, a family is not indicated in your immediate future, perhaps sometimes down the road, maybe within 3 to 4 years, and I hope that I'll hear from you again. The second letter comes to me from Mary R. from Newington, Connecticut. You asked me about career and government versus self-employment and staying near. Mary, in looking at your photo, waves of mixed emotions overcame me. First of all, you are a very, very honest person, so much so that you carry the greatest burden on your shoulders, which is the cares of the world. You know, you're only one person. You can only be responsible for yourself, and you can only do as much as you can within your own limit. Trust me, I know this from experience. Your job is very secure. If you were to branch out now, I didn't feel very comfortable about that because I feel some serious illness to one of your parents. 2 years down the road, if I were in your shoes, I might reconsider. There is no male partner, unfortunately, in your immediate future, but I also felt that you were all right about that. The third letter comes to me from Nancy B. from Sturbridge, Massachusetts. You asked me about the sale to your mother's house and retiring before the age of 65. Dear Nancy, in looking at your photo, my impressions were that you are a very hard-working woman at everything you do, whether it be in the home, outside the home, made no difference. Also, there were areas of your body from your neck to your hip section that concerned me. I didn't know exactly what, not being a doctor or diagnostician, I can only key into the areas. You may very well retire before 65 due to some health issues. You must slow down some, and I hope that you are not a smoker, because I also felt some respiratory concerns for you. The house needs some cosmetic lifts, I felt, and it would sell, but I'm not certain if it would be in that time frame of 1 year that you'd like to see it sell. Perhaps within a 2, maybe 2.5 year time frame, within that time. And the fourth letter comes to me from MS from Niantic. You asked me about your son resigning from his job and if there would be other work in the same field for him. Dear MS, in looking at the photo, I became overwhelmed with sadness, for there is much underlying current of emotions in your family. There is a strong need for some therapy, for an intermediary. Be very cautious and careful of the role that you play. Our children are very important to us, but we also have to know when to back off and let them lead their own lives. And I know as a mother and a grandmother that can sometimes be very difficult. Your son has had a lot of stress, so be careful, for he needs you to be supportive and he needs you to encourage him. Sometimes I think he feels that he's being berated or demeaned, and sometimes that's very hurtful. His health, physical, emotional, and mental, are a concern to me. I cannot feel a permanent work position in the immediate future for him. My mind said time would be lapsing, meaning he may not get a job right away. So therefore, he's going to need a lot of support and encouragement. And again, I stress a therapist, an intermediary, someone who can be totally objective. The fifth and final letter for tonight's program comes to me from RM from Simsbury, Connecticut. Oh, and this letter brought tears to my eyes and still does as I think of the photograph that you sent me. You asked me about money and dreams and true happiness. Dear R, in looking at your photo, my heart went out to you and still does, for your life has consisted of a lot of torment, and I feel that you have been under some medical care, physically, emotionally, and mentally. Please, please remain under the guidance of your doctors. It is so important for you. Continue to pray for your strength. I know that you are a man with a lot of inner strengths and inner convictions of where you stand in your position with God. And I know that that's carried you through. And I know that God will continue to carry you through. And ask him for happiness, because only God can give you real inner happiness. And he can also give you your necessary provisions. Thank you so very much for your wonderful and touching letter. And after this, I will come back and immediately take all of your as many phone calls as I can. So stay with me. Remember, the new number again, in-state and out-of-state to call, is 1-800-300-TV26. And I'll be right back after this. And we're back. Go ahead, caller from Burlington. You're on the line.
Hi, Pat. I was wondering, we had some financial problems with real estate about 3 years ago, and I was told that within 2 years that was going to all work out. Well, it's been 3 years, and I wonder if you see any break.
Okay, first of all, I don't know by whom you were told, but my impressions tell me that there is a lot of problems over this real estate, and it's not something that's going to be cleared up like this, and by your own admission, you tell me it's already 3 years. Eventually, it will. Unfortunately, I'm getting, I don't know, is it in litigation? Is there a reason I would sense that it has to go through other means outside of just...
we lost money through it, and we're in the new home now.
Okay, then there's a possibility then with the losses and the litigation that's coming to my mind is the fact that you're going to have to regroup. And my mind is tied up, and that's why I think I felt litigation tied up. Actually, it's just tied up, meaning time-wise. It will clear up. Unfortunately, I am feeling some extended time over it because there was great losses here. I'd love to tell you something to make you very happy, caller, and, give you some superficial appeasement, if I may. I can't do that in good conscience. Unfortunately, I do feel it's going to take some time for you.
Okay.
Probably not till down within another 1.5 or 2. Go ahead. You had another question?
My son is out of work, one of my children. Do you see him getting called back to his job, or do you see him with another job?
Okay. My mind said work. Now, meaning there will be work. Now, whether or not it's going to be from the old position, I'm really not certain. This might help you, though. I sense some mobility about him, and there's a big bridge. Now, that may sound silly to you, but there's this big bridge that keeps coming to my mind. So if it's not a place where he's been working, there's a place that he may be called to, and there's a reason for this big bridge. Either he has to keep going over it, the job is near it, but I'm talking, you know, a significant bridge. So if you don't understand what it is, then it's precognitive, meaning it's coming.
Okay.
So be patient.
Thank you very much.
He's anxious. He wants to go to work.
Yes.
So,
thanks a lot.
Thank you.
I enjoy your show.
Thank you so much.
Bye-bye.
Good night. Go ahead, caller from Brooklyn. You're on.
Hi, Pat. Do you see a serious relationship for me in the near future? I have plenty of dates and good times, but I'm looking for a committed relationship and one that I can fall in love again.
Yeah, and you're ready.
I'm ready.
My mind says you've been ready. Unfortunately, the type of persons that you're dating, you know the warning signs, too, because they're right there and you're ignoring them. You're dating, okay, only until you change your patterns, if I may, what your real needs are, and only until you're really honest about that with yourself and to your prospective dates, it's not going to change for you right away. So you have to get serious now, and you have to say, okay, whomever is coming, I don't mean, you know, on the first date say, hey, look, either you're going to marry me or we're not going to go out anymore. But stop letting them be in control of the date. You know what I mean.
Yeah,
I know
what you mean.
And the warning signs are there with the type of partners you're being drawn to. But in the last month and a half, I'm feeling like your mind is really talking to you. Your mind is saying, well, I'm not going to let that happen anymore. And you want to date a more sophisticated person. So don't accept anything other than that then, because that's what you're doing. So yes, it's going to change, but it's not going to be immediate. My mind's focusing more 2 years, 2.5 years. Now, that's within that time. That doesn't mean it'd have to be at that late time, but it could be. So I want to prepare you for it.
It's been a long time.
I know, but you've got to get it together now, okay?
I'm working on it, too.
I know you are.
Okay.
Okay.
Thanks a lot.
You're very welcome. Thank you. Have a pleasant evening. Go ahead, caller from New London. You're on.
Hi, Pat.
Yeah?
What do you see in my future as far as financial security concerning a career?
Well, let me ask you something, caller. Do the numbers 3, 4 ring a bell with this for any reason? 3 to 4, 3-4? Is there any reason those numbers would come to me about your career? How long have you been there?
I've been out of work almost 3 years, possibly.
Okay. That's why I picked up on the 3 to 4. Okay, then unfortunately, you may have to look then for another, probably toward the latter part then of this 4th year before things will change for you and your financial security to improve. Because that's exactly how I felt it, 3 to 4. And you said it's been 3 years already, so you're going into the 4th year. Unfortunately, you're going to have to be patient, and there will be some improvement, but it's going to be a while. So if you're considering changes, maybe even different kind of employment to be seeking, then I think I would like to encourage you to do that.
I have one more question.
Sure.
And what do you see for the future of my marriage?
Well, I know there's a definite need for some more open communication. There is some stresses, but my mind shows me a lot of external, and I know that money is part of that. And it's taking a toll on your marriage, unfortunately, and probably will continue. So you need to really talk about it more instead of letting the wedge that's this big become this big. I don't sense divorce in the immediate future or anything, but I'm concerned about the discomfort here, this wedge, this opening, and I'd like to see it. I'd like to see you bridge the gap. Okay?
Okay, thank you.
Thank you. Go ahead, caller from Danielson. You're on.
Yes, I recently had a breakup with my boyfriend. It's been very painful for me, and I'm just wondering if there's any chance of reconciling with him.
It's very painful for you for several reasons. One, trust is a big factor here. A lot of discomfort I'm getting about this, either trust of judgment, trust in maybe infidel reasons, just overall poor trust here, and a lot of loose ends. You're carrying a majority of the burden, I feel, because you've taken on 90% of the responsibility of this relationship breaking down, and you shouldn't do that. It's equal here. Both of you are rather responsible for the deterioration to have caused this breakup. You, because of a lot of insecurities, I feel, a lot of feeling apprehensive and feeling frightened to speak to him what's really in your heart. And for fear of doing that, thinking, well, he's going to get mad at me or pull away or break up. Well, ultimately, that happened anyway. I cannot feel reconciliation at this point because my mind tells me outside and external factors. Could be another person involved, another pending relationship, another pending going out, some sort of other external, I guess the word I'm saying is influence. So knowing that, if I were in your shoes, I can't tell you what to do, but via my impression, I think I would encourage you not to keep all your eggs in that one basket.
Okay, because he has been in contact with me again. I know he's not happy where he is right now.
No, he's not. And as I told you, there's a lot of factors, and if you don't get those cleared up, it's going to result in the same kind of problem. Okay?
Okay.
Okay. Good night. Go ahead, caller from Newington. You're on.
Hi, Pat. I had a lot of negative things attacking me right now, and it's just I just don't know which to handle first, and I just want to know if it's just going to be anything positive because...
Okay, well then you'll have to give me a question because I agree with you. There's an awful lot of things around you. So let's take one brick out of the pile and let me see if I can help you with it.
Okay, I'm separated, and I don't know to put my trust back into this relationship.
Well, let me stop you right there. Whatever existed to cause you for this physical separation, it still exists. And if you were to go back because you're desperate or feeling as though fearful of being totally on your own and being totally in control and becoming independent to take care of yourself, that would be for all the wrong reasons to get back on that emotional roller coaster, because that's exactly what your life has been probably for 4.5 years, mainly in that time frame. A lot of downs. So I would caution you, if you don't have an intermediary, if you don't have a marriage counselor or a middle person to be totally objective, I certainly would caution against getting back on that roller coaster. Okay?
Okay.
Okay. Thank you.
You're welcome.
Go ahead, caller from Bristol. You're on.
Good evening, Pat. Thank you very much for taking my call. My family's in a bit of a crisis situation concerning a parent, and I was wondering how that was going to turn out, and also whether or not I've got a job on the future here for me.
Okay. Let's go to that first question first. Why do I feel two of you, probably siblings, you and maybe one more, or you and two others, okay about this parent situation and somebody else not being, and it causing... I don't know, negativity within the family.
Right.
Well, time for kowtow. Do you know what I mean? Time to sit people down. Oh, you can't with one, can you? Okay, well, there's always telephones. So what you need to do, whomever can be together, it's time to discuss. Feelings have to be presented in such a light that other members are hearing it and not, just pacifying and letting them talk and wanting to get their own situations heard. People have to talk, the others have to listen, and I mean really listen. Take it in so compromises are made, persons' feelings are taken into consideration and respected, and this isn't happening. There's a lot of this stuff been for a long time, and now it's, everybody's feeling the effects of it. Please be careful of that and try to work through it. Don't let it continue. As for job, on the fence, my mind says. On the fence. So I can assume by that you're waiting for something.
Yes, I am.
Okay, be patient. You'll be getting off the fence soon. It'll be coming your way. Real hot weather comes to my mind, and then I'm sensing fall. So there may be two changes within that position that you're waiting for. So be patient, okay?
Thank you very much.
Thank you very much. Thank you so much for your compliments and your support of this program. Remember always, think positive and act positive. Good night, and God bless.